Have you unfortunately lost your unborn child, or you had a recent miscarriage? When you were trying to find out the reason for the miscarriage, the doctor couldn't come to know any particular reason. And this kind of a unfortunate miscarriage can be very, very difficult for a person as well as to their family. When you have a recurrent miscarriages, it kind of gives you a depression, a loss of hope. And many times, around 25 to 50% of the time, medical science does not know the exact cause of this recurrent miscarriage. And the cause is unidentifiable. And that's where a couple starts thinking, and even a doctor starts wondering what is the cause of the miscarriage. And this miscarriage, which can be so disturbing not only to the women but to the entire family. Sometimes such kind of a miscarriages lands up into a depression and sometimes a loss of the relationship. Many couples undergo through divorce also. And this problem becomes more and more difficult to manage when the miscarriages happens frequently. And this is called as a recurrent miscarriage. So when you have 3 or more than 3 episodes of a miscarriage, which is happening especially within the first 20 weeks of your pregnancy, we call it as a recurrent miscarriage. And why it is happening, it's very, very important to know. And when we are talking about the recurrent miscarriage, I am going to talk about one such hormone which is linked with such recurrent miscarriage. And what is that? How to identify? That is what we are going to study in today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, a hormone specialist doctor from Mumbai, India. Being a hormone expert, many times I see women, especially in the reproductive age group. And when they lose their child, a lot of times the other doctors, the gynecologist says, probably it could be hormonal imbalance. And the moment the hormonal imbalance comes, they come back to me and they just want to discuss that. The doctor, which hormone in my body is causing me this trouble? So understand, when we are talking about the pregnancy, it is a complex interplay of many hormones. All the hormones, when they are in their perfect range, you have a healthy pregnancy and healthy child. But even one of the hormone during this pregnancy, if goes haywire, it has a potential to threaten your pregnancy. And when you have a miscarriage, you experience either pain in your abdomen or you start having a bleeding down. And that's where a woman knows that they are having a miscarriage. So there is no one specific hormone which is causing the trouble. But definitely in today's video, I'm going to talk about one such less known and less commonly known hormone called as a prolactin. Of course, many other reasons can also be there. If you have uncontrolled thyroid, or if you have a luteal phase defect, or if you have a high androgen level of the hormones, if you have PCOS or a type 2 diabetes or a gestational diabetes, lot of issues can happen. And any of them can give you the trouble. But today I'm going to talk about the prolactin hormone, which is not much commonly known as compared to other counterplays. Okay. So first of all, what is prolactin? In just a brief, I will tell you, prolactin is a hormone which comes from our pituitary gland, which is located in our brain. This anterior pituitary gland secretes a prolactin hormone. In a woman, the prolactin hormone normal scenario, the level should be anywhere between 20 to maximum 25 nanogram per ml. It is this prolactin hormone which is actually called as a lactation hormone, which is actually going to prepare the breast for the future breastfeeding, which can happen after the childbirth. So prolactin hormone is mainly a lactational hormone. When you have a prolactin hormone in your body, it suppresses the FSH and the LH hormone from your pituitary gland. And because of that, the estrogen hormone also goes down. And that's the reason why when you have a high prolactin level, your estrogen level is low and you have a more frequent luteal phase defect. Now, just to tell you, luteal phase is a very important to ensure the pregnancy happens for the right implantation and for the rest of the 9 months continuation of the pregnancy. In fact, 17% of the women who have a PCOS have found to have a high prolactin level. And 36% of the women who had such a recurrent miscarriages were found to have a high prolactin level. So high prolactin level itself is considered as one of the cause of the miscarriage. But the unfortunate and the coincidental part is that prolactin hormone is very commonly linked with the thyroid hormone also. In fact, we see when you have an uncontrolled thyroid, your prolactin level can be high. And uncontrolled thyroid itself is an independent risk factor for the miscarriages. So when we talk about the recurrent miscarriage, we need to check not only the prolactin hormone, we also need to check the thyroid hormone. Many times, once we correct the thyroid hormone imbalances, we see prolactin hormone also falling back to the normal range. Of course, prolactin imbalances can be an independent factor also, but a lot of times this misdiagnosis is very commonly happening. And that's the reason why when we correct the thyroid, prolactin falls automatically. However, there are certain situations like a medical word, we call it as occult hyperprolactinemia, wherein a woman is having a normal prolactin level in the morning. But as the day progresses, their level starts rising. And when we see this occult hyperprolactinemic women, they have a higher luteal phase defect. And because of that, the miscarriage also happens. So what to do? I'm sure once a miscarriage has happened, you cannot do anything about it. But one thing we can do is definitely to prevent one such next episode. And to do that, before you start your planning the pregnancy, ensure that you check all your hormones. Of course, since today's video is about prolactin and thyroid, so you must check these two hormones. And if they are imbalanced, you need to control them. Treatment is very simple. For the thyroid, depending on what kind of a medical condition, your doctor will prescribe you either anti-thyroid medication or the thyroid hormone replacement. And if you have independent prolactin hormone imbalance, then your doctor can prescribe you either cabergoline or a bromocriptine medication. Sometimes, based on your prolactin level, your doctor might even advise you to undergo an MRI scan, but it is case-to-case dependent. So what you can do before you plan your pregnancy, get your thyroid and prolactin hormone checked, correct any imbalances are there. And once you are correcting that, you are reducing your chance of such an unfortunate event. Please understand, once you will be pregnant, the prolactin level will rise. That's how our normal body physiology is. So during the pregnancy, prolactin level tends to rise and it reaches to its maximum level by the time of the delivery. And once you deliver a child, the prolactin level starts falling down. By 6 to 8 weeks postpartum, the level is quite low, even though if you are continuing to breastfeed your child. So prolactin hormone is not that bad hormone. Only thing is that you need to keep them in track so that you can protect yourself from such unfortunate event. I hope after watching this video, you got some awareness about this topic, and I'm sure you got some good useful information. If you like the video, please click on the like button. If you are new to my channel, then please don't forget to subscribe. Your subscription gives me a lot of encouragement to make such videos. And if you have any such comment or a question in your mind whose answer you are seeking for, write that in the comment box below. I try and read them as early as I can. We will meet again with some new, good and useful information. Till then, you take care of yourself. Namaste.